want to thank everybody for joining us today on our free webinar overview of the new Exit Writer 8 program. Briefly, what we're going to do today, I'm going to provide an overview of the program and talk about what it is and what it can do for you. Then I'll walk you through a brief demonstration of the live product in our demo environment. So, moving right along, I'd like to spend some time talking about Exit Writer 8 and what it can do for your hospital or your urgent care center. CRAME's Exit Writer is the industry leader for emergency and urgent care discharge instructions. This is a program which was conceived and originally developed by a practicing board-certified emergency physician, and therefore it was designed to work the way emergency medicine professionals think. It's a program designed to be fast, intuitive, and complementary to the very busy, fast-paced workflow of the ED. It's really easy to learn. It's designed to be used rather intuitively with no formal training required, as you're going to see when I walk through the demo. And this latest version, version 8, offers everything an ED facility is going to need to quickly, easily, and effectively discharge your patients. It has a new, faster, and simpler interface. It has enterprise-wide patient education content options, meaning that CRAME's health sheets, which you may be familiar with as our inpatient education content, those can also be purchased through CRAME's Exit Writer. It has new multiple site access options, and it has a new electronic prescription functionality as well. I'm going to show you that today. These are just a few of the new enhancements to the program. So, a key point here that I think is important to point out is that CRAME's Exit Writer is also a certified EHR module to support meaningful use requirements. As with other patient education and discharge solutions that we offer, we have had Exit Writer certified by CCHIT for both hospital and eligible provider domains. Key meaningful use requirements met by this program do include medication reconciliation, patient-specific education resources, electronic copy of discharge instructions, and electronic prescription functionality. Under the eligible provider certification, we can actually fulfill up to about 16 different meaningful use requirements, and we can share that list with anybody that wants to learn more about this. So let's talk about what's included in this program and what's available. CRAME's Exit Writer has about 1,600 discharge topics included standard with the program. Each one of those comes in English and Spanish. And there are also 150 topics included in Chinese, Russian, and Vietnamese. Plus, with Exit Writer version 8, you have the option of including an additional 3,000 inpatient topics, our CRAME's On-Demand health sheets, as I mentioned, for educating patients across your entire enterprise. With CRAME's Exit Writer, users can browse a wide range of topics on diagnoses, treatment options, health promotion topics, medications, lab tests. You can also access forms to assist with informed consent, school and work release, and a lot more. CRAME's Exit Writer content can also be easily customized, either permanently or for a specific patient. So, Exit Writer's newly enhanced interface, which you can see here on the top right, is designed to be very easy to use. We designed this to streamline the discharge process and allow you to easily find and personalize discharge handouts with follow-up information and additional advice. You can also link to your registration system to eliminate data entry regarding patient demographics and medications. One thing that I want to point out here, based on feedback from our users, is that once you learn the program, which as you'll see in my demonstration does not take very long at all, this program makes it possible for users to discharge patients in about 1 minute's time. It's also worth mentioning that Exit Writer version 8 allows you to deliver your discharge instructions to the patient electronically by printing a PDF and saving that on a disk or a thumb drive, and that's going to help support meaningful use requirements for electronic delivery of discharge instructions. CRAME's Exit Writer offers 2 different types of prescription features in this version. First, included standard with the Exit Writer program is our Write8 prescription writing feature. But a newly added optional enhancement with this new version is an e-prescribing feature, which allows users to send prescriptions directly to the pharmacy. And to do this, we've partnered with a company called Dr. First. I'll talk about them in a moment. But first, our standard prescription writing feature, Write8, it saves time for clinicians over handwriting prescriptions, and it reduces medication errors. It allows physicians to create legible and accurate prescriptions quickly and easily. And with version 8, the feature is now enhanced with a new drug list and new data. And again, that all comes standard with the program. As I mentioned, the new integrated e-prescribing module, this was designed to help our users satisfy DEA controlled substance and controlled substance e-prescribing requirements, as well as help meet meaningful use criteria for e-prescribing. And a little more about that. Just a few words about our partner for the new e-prescribing feature. Dr. First was founded in 2000. They are the nation's leading e-prescribing and solutions platform provider to physician practices, health plans, health systems, hospitals, EHR vendors. And though it's through its Open Borders program, Dr. First Solutions integrate with about 200 different EHR practice management and HIT systems. They're a SureScripts Gold Certificate Solution provider for 4 consecutive years with 3 award-winning Arcopia electronic prescription management system. Dr. First utilizes SureScripts Network for pharmacy connectivity, health plan information, and patient medication history. They are the most decorated prescription management software vendor, having earned over 12 awards, certifications, accolades, medical society endorsements, and earning ISO certification. We chose Dr. First because they offer a proven, mature product. It was created by doctors for doctors with a lot of user-influenced enhancements. We just thought they were the right partner for what we were trying to do. So that's just a little background on our partner for this feature. I'm going to show you that feature in just a few minutes. A little bit more about it. Just to speak a little bit about the module itself, the module lets you electronically send accurate, error-free, and understandable prescriptions directly to the pharmacy from Crane's Exit Writer for improved patient safety. Physicians can save their organization time and money in prescribing documentation, transmission, filing, billing, numerous telephone conversations that you have. The module improves patient safety with automatic drug interaction checking, dosage checks, adverse reaction checks. It also provides access to patient medication history. The tool is going to help reduce pharmacy phone calls, simplify the prescription renewal process, provide formulary status on the medications, and it's going to help your organization basically take advantage of the CMS e-prescribing incentive program, as I mentioned. Crane's Exit Writer also helps meet meaningful use criteria for medication reconciliation. Exit Writer contains a tool that allows you to document and record patient medication status to comply with medication safety requirements. An electronic copy of all information is given to the patient, and it's captured in the patient record as well. As we mentioned, we're also certified to meet meaningful use requirements for medication reconciliation for both hospitals and eligible providers. Also included in this program is an auto fax to referral provider function. This helps improve continuity of care and communication with the patient and with your referring physicians. It's going to help ease workflow and smooth transitions. Using this feature, you can fax notes or a summary of the care that you provided directly to your referral doctor. That includes communication on diagnoses, prescriptions, tests performed, follow-up advice that was provided to that patient, the date of the visit, the patient details, and the attending physician. This is a great tool for helping improve care transitions. Crane's Exit Writer also allows you the ability to fully integrate the discharge solution into your workflow. We have an interfacing solution with your existing technology that is optional with our HL7 interface. This allows you to import and export patient data, including medication, gender, and weight information, right from Exit Writer to your EMR and into the program. Also, with Crane's Exit Writer version 8, users can auto-generate and assign unique patient medical record numbers and visit IDs directly from the Exit Writer program for those that may not want to interface with the EMR necessarily or may not have an EMR to interface with. Exit Writer uses strict HIPAA enforcement guidelines to make sure that patient information is protected and that your organization is protected. And lastly, Crane's Exit Writer version 8 is a true enterprise-wide solution. We are now offering new multi-hospital program access to help standardize care across the entire enterprise. For health systems and hospitals with multiple locations, Crane's Exit Writer has the ability to connect remote sites on the same database so that users can share data across that enterprise. And lastly, a word about our pricing. Exit Writer is designed to be simple and affordable. It's priced to fit a variety of organizations with different pricing options to meet your needs. You can license the software program or even just the raw content for integration into your own systems. We're known for our high-quality content. Many of our clients simply have a need for great discharge instructions, so we can provide that for you. Pricing is based on either annual visits or number of physicians, depending on what kind of organization you are. And we offer a very low-cost HL7 interface option, as I mentioned, to connect that program into your EHR. Just like I mentioned before, we offer an optional e-prescribing feature, or you can use our prescription writer, which is included standard with the program. But today I'm going to be showing you the e-prescribing feature that I mentioned. So just to sum things up, Claims Exit Writer, again, is designed to help you match the ED workflow and save you time and money by streamlining patient discharge while you're still maintaining the high quality of care that your organization strives to provide. The program is easy to use, and there's no formal training required. I'm going to give you a brief demo in a moment just to show you how simple and intuitive the program can be. The program is a certified EHR module for both hospitals and eligible providers that's going to help you meet meaningful use requirements, including electronic delivery of discharge instructions, as well as medication reconciliation, e-prescribing, patient education resources, and a lot more. There's a lot of different criteria that are met with our certification. Features like fax to referral MD, that's going to help you enhance communication, improve care transitions, and our HL7 interfacing option allows you to fully integrate the program with your workflow. And that's basically our summary, our basic overview of the program. I do want to go ahead and walk everybody through a quick demo. Access it here. Everybody should be seeing the demo on their screen right now. If you do hit F5, it should fit to the screen if you're having any problems seeing it, but I'm going to go ahead and get started. What you're looking at here is what the screen looks like once you log in. I've already logged in. At the top right, you can see I'm logged in as John Smith, MD, and basically this is the first screen you're going to see, and the first thing you're going to want to do is select your patient and add them into this program for discharge. Now, you can there are two buttons at the top right. You can add a patient from scratch, excuse me, using the information that you see here, or you can actually select somebody that's already in your queue, which I'm going to do by using this second button right here. Or simply, if you can search through your current patient queue, you can see the buttons at the top left there that say last name. I'm just going to add a few letters of the person's last name, and the patient I'm looking for came right up. I'm looking for Mr. William Carson. I double-click on his name, and he is now loaded into the program and ready to be discharged. So you can see in the center at the top here, right under the birth date, there are 4 different steps to this program. Selecting the instructions that you want to give the patient, advising the patient where you give some special advice, and you can also fax information to a referral MD, e-prescribe, which is the prescription writing feature, and then your print list where you can kind of review everything at the end. So we're going to go through the first step here, select instructions. Now, if you look under where it says select instructions on the left-hand side here, there are a number of different areas that you can get instructions from. We're just going to be using the Exit Writer discharge instructions today, but you can see these other tabs for health sheets, lab tests, medication sheets. This tab that says health sheets, as I mentioned, you can actually buy an additional package of content, of inpatient content, inpatient patient education documents, so you can kind of support patient education through your whole system. We're just going to search through our discharge instructions today, which is the Exit Writer tab. Now, you can actually drill down to the different types of discharge instructions we offer. There are diagnoses and complaints, treatments, devices and dressings, exams, self-care, forms, and you could click on any one of those, and it's going to pull up content that's already loaded or already tagged to that topic area. You can scroll down and find a specific topic, or you can actually enter a few letters in this search box under the word Exit Writer, and it'll bring up certain information, or you can just click right on the Exit Writer tab and search through the full database of content. And I'm going to do that, and we're going to walk through discharging Mr. Carson for an ankle fracture. So I'm going to do a quick search. I'm just going to write the word ankle. And one of the first results that comes back, you can see ankle fracture. I'm going to scroll over ankle fracture right here. I'm going to scroll to the right, and if you click on this little eyeball icon here, you can kind of preview the content before you go adding it to the print list. You can kind of review it, make sure that it's exactly what you're looking for. and that is what I want. So I'm going to go ahead and just double-click on ankle fracture, and if you look to the right, you can see it's been added to patient instructions. Now, when I did that, if you look at the bottom of the screen, it automatically brought up some related topics. I want to add some information here on cast care, specifically AirCast. I want to add this AirCast sheet. I could review it if I choose to. Once I decide that that's what I want, I'm going to double-click on that, and that is now also added to my print list. Now, before I move on, I actually want to get a work release form. So on the far left, I'm going to select Forms right here. I'm going to remove ankle, which is still in the search box. And I'm just going to kind of look through all the forms that are available. Work release is the last choice that I'm now scrolling over. I'm going to double-click on that, and it's going to bring up this screen, which allows me to put in some information. You know, I can kind of put in the specifics about this patient's work release form. So we're going to say no heavy lifting for 20 pounds, desk work only, any kind of other restrictions that you want to add. I'm going to click. I'm going to put a date that this applies through. We'll say a couple of weeks. I'm going to click OK, and that work release form has been added to my patient instructions. So now I'm kind of done with the patient instructions I want. I'm going to move on to the advised patient section by clicking on this second tab at the top of the screen. Now, this is where you can send over a summary of the discharge instructions to a referral provider. Now, there's a couple of ways you can find your referral provider. At the top left here under provider, just if you click on this magnifying glass, it's going to bring up a list of everybody that's already in your system. Or under specialty, I can select by specialty. Let's just say we're looking, if I click on radiology, for example, and that's going to bring up, relevant doctors under that specialty. But what I really want to do here is I know the doctor that I'm looking for. I'm going to enter a few letters of his name, and there he is. I'm looking for Jerome Bornstein. I click on his information. It gives you his address, his phone number, his fax information. You can say call for an appointment in 2 days. If I have any notes that I want to provide to Dr. Bornstein, I'm going to add them right here. You see the fax number right here. As I mentioned, you can fax this information over to that referral physician in advance. So that's what I want to do. All my information is correct here. I'm just going to click on this button on the far right, and now that's done, and that's ready to be sent over. I'm going to add some additional advice to the patient. Now, I do that just under the referral section on the left-hand side where it says additional advice. I could click right into this section, and I can add any kind of special instructions I want. There is some pre-populated information here that you can choose from. I just happen to be wanting to give information about X-ray. I'm going to double-click on that, and that information can be pre-populated in special advice for the patient. And I can add to that as I want, or edit that information as I see fit. I want to give some summary information on tests and procedures that were performed during this visit. I can just use this drop-down to kind of look for information I want, and here is X-ray information, and even X-ray information about ankle. So I want to hit X-ray, ankle right. I click on that, and I'm going to, again, click on that checkbox, and that's all set as well. I'm going to briefly open my print list here on the right-hand side, and you can see this additional information. The discharge summary is now also in my print list. So at this point, I'm ready to go and enter some prescription information for this patient. So I'm going to click on the ePrescribe tab. And what that does is it's going to turn this functionality over into the Dr. First environment. Again, Dr. First is our partner. They are our e-prescribing partner, and this is what the e-prescribing interface does look like once you log in. And I'm just going to kind of walk through some of the things that you're going to see and some of the things that you can do in this program before I go ahead and prescribe a medication. At the top, I have my practice information. Everything's been brought over into this interface. So a lot of this stuff is pre-populated. Here's patient information for Bill Carson. His preferred pharmacy has been brought over into this program. You can actually change or select different pharmacies from the network of pharmacies that are already loaded into the e-prescribing module by clicking Change right here. if you look towards the bottom underneath prescribed medication, if you look right here, there's going to be a list that's been brought over from the patient record about medications that this patient is currently using. There are 2 that are listed right here. If I wanted to add some more, I'm going to click on Manage Medications. I would just push that button right there, and I could actually remove these. I could stop them. I could add new medications if I've learned more information from dealing with my patient to this list, and I would save it for future reference. Also at the bottom here, you can see allergic reactions that this patient has. They're already loaded in here. This patient has 2 different drugs listed that he is allergic to. So if I go to enter the prescription up here where it says prescribed medication, you're going to get an alert. It's going to alert you that there is an adverse reaction possibility to either the medications at home, or there's an allergic reaction warning that's going to come up if what you're prescribing is going to conflict with these allergies. So, all of that stuff is built into this program. In this case, I'm going to try and prescribe. I can't prescribe a controlled substance in this state, as a lot of people know, but just for the sake of example, let's say I want to prescribe Lipitor for this patient. You can either enter Lipitor in, or as you just saw, there's a favorites list. The favorites are actually favorites associated with the doctor that is using this program at that time. So in my favorites list is Lipitor, or I could have just looked up Lipitor by typing it in, and I would have hit find right here. And it's going to bring up different examples of Lipitor. I'm going to do 20 milligram tablet, and there you can see duplicate therapy alert. Now, this patient, Bill Carson, is being given Caduet, which is in the same therapeutic category, and so it does warn you of any kind of adverse reactions that may occur. You can choose to prescribe anyway or cancel. In this case, I'm going to cancel. So, just to give you an example of what you can do, let's say I'm going to prescribe Cefprozil. I'm going to choose it from my favorites list and hit use. Okay, and now you can see there is a pending prescription for this patient right here. Now, all you really need to do at this point is you would sign in using your unique password, and you would send that prescription over to the pharmacy. If you happen to log out of here and you go back in to add more information, and you open your print list on the right-hand side of Exit Writer, you can see that pending prescription is still there up at the top in prescriptions. I just kind of wanted to point that out. I'm going to go back into ePrescribe right now. I'm going to enter my password, and I'm going to hit send and print. It's going to then show you some information. You need to accept the terms, and there is an example of the prescription that was sent over to that pharmacy. So I'm going to log out of there for now. That is pretty much the 3 main steps to discharging your patient. And then I'm going to click on the Print List tab all the way on the right, and I'm going to review everything. Now you can just go all the way to the bottom. At the bottom right-hand side, there's a button that says Preview. If you just click on that, it's going to bring up the discharge packet. We have the discharge instructions that I selected for this patient on ankle fracture. Here's just more information about ankle fracture. Here's the information on AirCast. There's the work release form we added. Here's the information that we sent over to the referring physician. And I've got everything I want. We saw on the print list that the prescription has already been sent. So everything here looks good. I'm going to go all the way to the bottom here, and I'm going to click Print. So, and that's pretty much it. That's how you use this program to discharge a patient. And I spent a lot of time showing you things, but I think you can get an idea of just how quickly you can use this program. Like we said, we do get a lot of feedback that shows this program can actually be effective for discharging patients in about a minute's time. So I'm going to go back now. That pretty much brings us to the end of our demonstration. At this point, I kind of want to open things up for questions.
Thank you very much. At this time, if you'd like to ask a question, you can do so by pressing star, then 1 on your phone. You'll be prompted to record your name so I'm may introduce your question. Once again, that is star, then 1 if you'd like to ask a question. One moment, please. And at this time, I show no questions coming into our queue.